Okay. So in Portugal, the impact that COVID had in our services and the country was not the hugest one in the world, but it's still a big one considering the other countries around us or in Europe. We had a lot of infections. We still have a lot of infections. Um, we could control it with some measures like confinement and people staying at home and home working. But anyway, this has more consequences that probably we weren't able to measure still. So most of the health services they closed during the main COVID period in Portugal, meaning that they were specialized in COVID. So only people with really severe diseases were allowed to go to the hospitals, and in with a lot of restrictions, like for blood analysis, and most of the appointments were done by phone or other means other than a presential appointment, which means that most of the communities that are usually have problems or have obstacles or difficulties to get to the national health system, they were in a bigger difficulty this during this period. Additionally, most of community-based organizations that were in the field, including mine, were struggling to provide services within all the measures of security that were being proposed by the health authorities, meaning that we need to purchase masks and other security materials that were not available. And Portugal was not the only case, all around Europe and the world, that were not available in the amounts that we needed for one side. From the other side, they were too expensive for some community-based organizations that were not foreseeing this kind of expenditure during this year. Which meant that a lot of people weren't able to get the kind of health care that they needed and they were expecting. Um, the only services, well, of course, we try with some other community-based organizations also to provide some services to the communities that were most at risk and that needed it most, like migrants and people doing sex work, people using drugs, which we couldn't really stop giving them some services because of course, human rights, which is the first thing that we should remember. The second one, it was, of course, individual benefit. And the third one, it was, of course, a community benefit because although we were in this situation trying to contain COVID, we were also trying to contain other epidemics that we are fighting for long and that we are now, seeing some light in the end of the tunnel. So a lot of services were modified. Most of presential appointments were closed in every community-based organizations, in the NHS as well, NHS as well. So this is something that I think that it's one of my recommendations for the future is that we need to bear in mind that a country could not be divided, a country or the Europe or the world, in COVID patients and non-COVID patients, because non-COVID patients, which was the division made in Portugal, and I think that in other countries, are a huge portion of miscellaneous diseases that needs care, and in this case. In our fields, HIV, hepatitis, STIs, tuberculosis, we thought and we understood that from the point of the government and the health authorities, there was lack of support, meaning that they were so busy with COVID that they forgot about everyone else or other diseases. So gradually they were taking notes and they were noticing these other diseases, but not in the beginning. So there were a lot of constraints, like people having problems with getting their drug supplies, people having problems seeing some of their medications going out and didn't know if they, have to break the medication or not, and people with doubts about their health without any answer. So this was really I think very stressful for people that are living with diseases. For one side, for the other side, we know that, for instance, migrants that were doing informal work, meaning that they were being paid but they didn't have like contract, which happens a lot not only in Portugal but all over Europe. They were in a very, very difficult situation because they had no money. No one could take care of their health because they have always problems to access to healthcare, and it was very difficult to find help to these populations because no one was funding, giving us money to support them. But this was one of the populations that I think that most suffer during this time, because they didn't have food, they didn't have a way to pay their rent, they didn't have anything. So, and what we were doing as country, it was testing COVID and preparing health services for COVID, and these people were in a very difficult situation all those time. Also, buying other kinds of medications for chronic disease, meaning that people from these communities, and some of them living with HIV, but they live also with other diseases, and they need chronic medication. And in this case, they didn't have money to buy this chronic medication. And from another side, it was also difficult to access the medication because pharmacies were working in a different way, and they needed money to go there. They need a prescription for a doctor. They didn't have access to doctors or to healthcare. So this was very challenging for us as community to provide. So in the future, I think that although good measures were taken in Portugal, like all people that had process of being legal in Portugal, they were immediately approved. This could be also a nice recommendation when such emergency period occurs, like COVID. If there's people that are have ongoing processes for becoming legal in a country, this should be immediately approved because people need to be legal to have access to a certain amount of services and rights. So, although this was done in Portugal, it was not enough because a lot of people didn't have processes ongoing in the authorities to become legal. So all these people, we needed to support them with money, with services, with help, with information. Without any kind of support from state or other kind of supporters. Also, sex workers and transgender community, they were in a big struggle, because their work, of course, is sex work, and of course there was a decrease of clients and work, but they still keep working. We were getting information from them saying, well, we need to pay our bills, we need to pay the rent, we need to feed ourselves. So we need to work, and we still have clients. So during COVID, they were receiving people, so this was also from a point of view of epidemic, it was also a quite delicate situation, meaning that we needed to ensure that they had protection materials, both for sexual transmitted diseases, but also for COVID, that they had information, that they had, enough medication for sometimes for chronic diseases, which they didn't have money to buy because they were, having so few clients, and from another part also to have money to survive and to pay the regular bills and and to eat. So we don't know we don't know the extent of the impact of COVID in Portugal, and I think all over the world in these communities. We know, of course, because now we are already restarting working, and we know that there were some infections during the COVID period. We don't know how much and how big it was. Um, but I think that health authorities and policymakers need to think better in these communities in the future because they are part of the community. They are part of Europe. For instance, if we think at the European level, they are part of Europe. They exist. They live in our countries. They are, you know. They are entitled to have their rights, their human rights as well. So these communities that are usually the most at risk when we are not in a COVID emergency situation, during this situation, they were even more touched and even more at risk. So we need to make sure that the next time that we have this kind of emergency, we have the right tools to work with these populations. Otherwise, we will have always the risk of in, well, being really, really good in containing COVID, but spreading or let other epidemics grow. And we still don't know if it was the case right now in Portugal for HIV and hepatitis. We try to provide a lot of injecting material, like syringes and other materials for people using drugs. So we didn't stop ever to provide these kind of materials here, but I'm not sure that this is the reality everywhere. So, meaning that everywhere, even in Portugal, not only in Europe. So this we don't know what will be the impact in the future. So my recommendations, it will be one of them. It will be we need to prepare for this kind of epidemics, and we need to have like a to-do list. What do we need to do in an epidemic like this? One thing that we understood is that countries were not testing enough. Even though it's true that testing was not available all the time. But once they had the capacity of testing, they were not testing enough. And some countries are still not testing enough. So it's very difficult to understand the current situation if we are not testing enough. Secondly, we should, of course, offer other tests during this period. And of course, HIV, hepatitis should be one of the tests that we should be providing during this period. And of course, for free, confidential, all of this. The other thing that I think that it was really a pity is that, and I don't know if it happens everywhere, but I heard and I talked with friends from other countries, and I think that it's more or less the same, is that the health authorities, all the stakeholders and decisions, they didn't take advantage of the community experience, getting to the most at risk populations and working with populations that are actually not accessing the health services, meaning that people, most of the regular Portuguese guy or girl, he will go to the hospital if he needs. But migrants or sex workers or people using drugs, they don't have this kind of opportunity because sometimes they are stigmatized, other times they don't have documents to go there. So it was a pity to see that the government was, or the authorities were not relying on NGOs and CBOs to get to this population, to these people. So and of course to maintain a level of services and through the community that could enhance, to maintain also that the other epidemics contain, or at least at the level that they were before. So this is something that I think that it could be really adopt in the future with the to-do list that I was proposing, because if we have like European policy, around not only COVID but epidemics, we still didn't manage probably to have to HIV and hepatitis. So this is also a lesson learned that we need to speak the same at the same voice, at the same tone regarding infectious diseases. If we do it, it's so much easier to work. We could see the collaboration between countries when they collaborate, like Portugal and Spain. Things were much smoother, and they could, work much better. So definitely to have like a to-do list, a policy around infectious disease and what's the best way to do it, to make sure that we will not be hurting the human rights of some people, like inmates, in Portugal. Some were released with minor crimes. They were released to make sure that uh, well, the prisons were not so full as they usually are, and if they had the epidemic in the prison, it was not so severe, which thank God didn't happen, but it could happen. So, but I'm sure that Portugal was not the only case where if an epidemic within a prison happened, it would be very difficult to deal with that. So there's a lot of I would say gray zones that we don't know from the future. And regarding, other diseases like HIV and hepatitis, where we are working, during these 2 3 months, they were completely, forgot. And I have the example in Portugal that and if we remember that doctors that treat HIV and a part that treat hepatitis, they are also the ones that treat COVID-19. So you could see how this could be a big mess if we don't plan ahead. So in Portugal, it was very difficult to talk with the people that were dealing with, HIV programs. They were responsible for HIV programs in Portugal because they were dealing with the COVID response. So I think that in the future we need definitely to organize better because now it was COVID. Probably in the future it will be other disease with the same impact, and we need really to make sure that people have access to tests, people have access to health and also to social rights. We cannot close the country and don't remember that we have people that need help, and they need the organizations, and they need, the support from the state. So another point is data. The way data is being collected and shared, it's really, it shows how the fragility of the systems, because we took a time here, and I think in Europe as well, to have a system to report uh, data on COVID, and we still don't have a lot of data on co-infection of COVID and hepatitis and HIV. So um, this is something that we need to have better data systems. We need to be prepared to collect data in different ways to involve us as well community in collecting the data. As I was saying, it was a pity that the governments and states didn't rely on the experience of community organizations, because we know how to collect data and we know where people are. So to collect data and also to prepare to understand what is happening, to know how many people is infected in Portugal or in Europe or in Spain or in France. It's not enough to know how many people is dying. It's not enough. We need to know the impact in the population, not only in the populations that we work with, but all the populations: diabetic people, people with oncological disease. So we don't have any idea what was the impact in these populations, people that were under chemotherapies or people that weren't able to get their treatments as usual, people that probably were not giving the best follow-up for their chronic disease. So this is something that some specialists say that we have probably more deaths that usually in the same period that we usually get because there's a lack of access to the system or health system. So there's also some people that die from other diseases that are not, being counting as COVID-19, but it was COVID-19 because they didn't have access to the system. So we need really to do it better in the future and to understand how can we still provide health services and to use also another recommendation to use also the technologies. We learned so much during this epidemic, using our webcams, using the email, the phone, and all the software that was also created during this epidemic. And we had already, and before COVID we had it already, technology that allow us to provide health services without presential appointments. So I think that the countries need to be prepared for that as well, and people need to have access, which is also another important thing, because this needs to be something really straightforward and simple and affordable, so people can really access to health services during this period. So I think that in a nutshell, this is what I wanted to say to recommend. I hope that in the future we can understand better, we can work better as Europe and not only as individual countries, and to have policy to a policy to all Europe regarding infectious disease and how to um, fight back and to proceed during an emergency as this one. I hope that community-based organizations don't have to close their services for lack of support in the future, because the communities that they are serving are in needs, and they cannot get the services from other parts in the country. So I hope that this is also part of the future, and I definitely know and believe that we have the tools to be able to fight an epidemic like COVID, and at the same time provide the right follow-up to people with other diseases and contain other epidemics, because